Thank you so much, everyone, for joining us today. This is our Friday federal COVID-19 updates. And today we have two special guests we're very excited about. We have Nicole Jorwic, who is the Senior Director of Public Policy at the ARC of the United States. And you heard Dan Burke is the CEO and President of Lifeworks and the ARC of South Norfolk. So thank you both so much for joining and participating with us today. So just a quick overview. I know many of you are familiar with the ARC. We are an umbrella organization. We have about 17 chapter affiliates, and we work with provider, government, and advocacy agencies. And the mission of the ARC of Massachusetts is to enhance the lives of people with intellectual and developmental disabilities, including autism, and their families. And we fulfill this advocacy for community supports and services that foster social inclusion, self-determination, and equity across all aspects of society. We're also a state chapter of the ARC of United States, which is our national membership, and they have hundreds of chapters across the country. So for today's agenda, as I said, we have Nicole and Dan here, and they're gonna talk a bit about how we maintain the stability of services for people with intellectual and developmental disabilities and their families with what's happening at the federal level with the federal COVID relief packages. We'll do a Q&A with Dan, so we'll have an opportunity after both of them speak to do questions. And then I just have a few updates in the end to talk about at the federal and state level. And then we'll have another opportunity for some more questions at the end. So I'm gonna have Nicole start and talk about home and community-based services.
Yes. Hi, can you hear me okay?
Yes.
Okay, great. I'm going to shut my inner email so that it doesn't keep dinging. Not sure if you can hear it, but I can. Happy to be on the phone with you all. As Ellen said, my name is Nicole Jorwic, and I'm the Senior Director of Public Policy for the ARC of the United States. I'm one of the 5 lobbyists that we have on staff at the ARC of the United States. And all we've been doing since the pandemic started is making sure that the needs of the disability community have been ringing through the halls of Congress. And that has been extremely helpful because of all of the great grassroots work that is going on, including a lot coming out from Massachusetts. Between Ellen and Maura and Leo, you all are so well represented at the state level, and we're very glad to have the ARC of Massachusetts help to fight in the face of this pandemic, but generally always. I'm going to take a little bit of a step back. I'm going to talk about some specifics about Package 3, but I just want to talk a little bit about all the legislative packages that have come in the face of the pandemic. So the first package was really about the emergency response. The second bill did include a FMAP, or federal match, increase of 6.2%. That's an additional 6.2% of federal dollars that states will get in their match with the federal government for the provision of Medicaid services. That funding is something that the ARC supported. We actually supported a higher FMAP bump, but it's something that states needs as the budget is going to be so stretched now and in an ongoing way for the state budgets will be stretched. But we also know that because there's such a high need in a variety of different ways, that we still need some specific funding and specific supports for home and community-based services. And so after Package 2, we really started pressing around 2 bills, Senate Bill 3544 and House Resolution 6305, and those are the Coronavirus Relief for Seniors and People with Disabilities Act. Representative Dingell in the House and Senator Casey in the Senate are the leads on those bills. And those bills, what they would do, and that's going to be the biggest push that we have moving forward, but it would create grant programs, and I'll go into a little bit more details about that. But we had started pushing for that before Package 3. Unfortunately, there had been some misunderstanding by legislators that that 6.2 FMAP bump was enough to provide the supports and services that we were talking about in home and community-based services. So just a little bit of insider baseball about why some members of Congress felt like they took care of Medicaid in Package 2, not understanding the specific needs of disability service providers, specifically in terms of providing home and community-based services. And so though we were happy to see that that grant program HR 6305 was included in the package that Speaker Pelosi introduced the week of March 23rd, it was not in what ultimately passed in Package 3. In Package 3, that passed on March 27th, and what was included was a short-term extension of the Money Follows the Person program. The Money Follows the Person program is a program that provides additional funds, 100% federal dollars for the first year to transition individuals out of nursing homes or institutions and into homes and communities. So this was part of a broader negotiation around extenders that also included spousal impoverishment protections. We wanted permanent MFP, so that was not what we were hoping for, but it was part of a broader negotiation around those extenders. The Package 3 also does allow, did include a bill that allows for a state option for home and community-based service waivers to allow for direct support professionals to support individuals during short-term hospitalizations. I want to be really clear because there's a lot of misinformation about this. This was a bill that Anchor and the ARC had worked on before COVID. It's a state plan option, so the state would have to submit to CMS to provide this, and it is not COVID related. So this is not a bill that allows for DSPs to go into the hospital now. It is about billing Medicaid. It is about that if a state puts that state plan option in their waiver, that providers can then bill for DSP services in the hospital. So I just want to really clarify there. It was a nod to the community, but obviously not what we wanted. What we wanted was the grant program. There were also some funding streams for home and community-based services. However, there were also some relief funds, provider relief funds that HHS has. So far, those have only gone out to Medicare providers, but we're pushing that the next round has some goes directly to Medicaid, and we're hearing some positive things, but we've been disappointed so far. Next slide, or can I do it? Sorry. Yeah. Oh, sorry. Thank you. So I already talked about the HCBS grant program, but I want to talk a little bit more about what it does. So first of all, it's based on 15% of each state's Medicaid spending on home and community-based services. So it would be, the grant program would be based on 15% of what Massachusetts budget is for providing home and community-based services. Those would all be federal dollars. It wouldn't require a match, and it would be a grant program. It would provide wage support and flexibilities for direct support professionals. It would provide things like hazard pay. It also has retention and retainer components for the workforce, and it is also includes language that it is for individuals who are currently receiving home and community-based services or eligible to do so. So it also could, states could use some of the funds to provide services for individuals who are on waiting lists. So that is our main ask for Package 4. Next slide. I covered this. It would cover retention and recruitment for the workforce. In addition, we are seeking to deem the direct support professional workforce and home health and personal care attendants as essential so that they have access to the desperately needed personal protective equipment and medical supplies that they need to keep themselves and the people with disabilities who they serve safe. I know that several states have taken action at the state level to provide this workforce as essential, but we really think there needs to be federal action. And we are also working to ensure that definitions in every proposal are inclusive to services that the workforce provides, including employment services. So we want to make sure that that job coaches, for example, aren't left out just because they're not necessarily providing services right now, although some have certainly changed.
Nicole,
Oh,
Nicole,
yes.
this is Dan Burke. Just want to clarify for people listening, in Massachusetts, our workforce has been deemed essential healthcare professionals.
Thank you. Thank you for that. I was going to ask, so thank you. The fourth package, because so yesterday there was a third package, but it was, or fourth package, but it's being referred to as package 3.5 because also what package 3 did, and I know that that Dan is going to talk about this. A lot of it was around the small business loans and the stimulus payments, and there's a lot of pieces of that we also need to work on, but they did pass that interim legislation yesterday, and so there will be those additional funds. Congress is expected back on May 4th. The House has the pen, which is a positive thing because, as I said, the HCBS grant program was included in the Speaker of the House's draft version of Package 3, and so we're hopeful. We also know that Representative Dingell has made it a member-level personal issue that she has raised with the Speaker, so we are hoping that that means that we will have traction in getting it in the House, and then once we get it in, it'll be about keeping it in. Next slide. So again, I think I've made this pretty clear, but the main asks that we have are around funding for that home and community-based services grant program, personal protective equipment, and that deeming of essential workforce, paid leave for caregivers. So there have been paid leave provisions in both package 2 and package 3. However, right now they don't include, they wouldn't include caregiver paid leave support for siblings, for example, of people with disabilities, or grandparents caring for children with, or it would be for children with disabilities, but not for adults with disabilities. It's a very strict parental definition, and so we're working on that. There is also a glitch that my colleague Bethany Lilly, who I know you guys heard from last week, has been working very hard on around making sure that people with disabilities who are claimed as dependents on other people's taxes also are eligible for stimulus payments. There are 2 pieces of legislation on that to get that fixed, and I'm sure that Bethany will send things out and Ellen can pass those along to everybody. But those are our main asks for package 4. And then, you know, it's really important to note that when we're talking about these packages, these are all relief packages, and eventually we're going to turn to recovery packages. And what all of this is highlighting, whether it's, I know that there's situations in Massachusetts, just like in my home state of Illinois, where there are huge outbreaks of the pandemic of COVID-19 in institutions or state-operated hospitals and developmental centers. And we are really seeing the public health issues that can stem from some of these settings and the real need to invest in home and community-based services and the workforce that was already in crisis before this started. And so eventually we're going to turn to recovery packages. And I just want to be really clear from the national office perspective. I said on our staff call yesterday that if the government's going to have a checkbook, we're going to be first in line to fix some of the problems that are being highlighted systemically in the face of this pandemic. So I think that's all I have for now.
Thanks, Nicole. So we're going to have Dan Burke discuss his perspective as a chapter exec on what the federal relief packages have meant for the ARC chapters and their staff.
Thank you, Ellen. Thank you very much. Thank you, Nicole. I'll give you some brief overview as to some of the packages that chapters are dealing with. And of course, first and foremost, we hope everyone is staying healthy and able to stay healthy. The Families First Coronavirus Act, referred to commonly as FFCRA for those of us who are dealing with every day, is a paid leave bill for supporting employees. I want to make sure people understand for nonprofits and for healthcare providers in the state of Massachusetts, they are exempt or can be exempt from this. So not all providers, and probably the minority of providers in Massachusetts, are providing this to their employees. And the reason for that is how it relates to people being essential healthcare professionals. Organizations have their own leave of absence policies, their own leave protections for employees, and many and all are doing that for their employees. But the FFCRA and the inability to get employees and the options provided there, for example, hospitals and direct healthcare nursing homes are not offering this, and there are a number of providers who are not. Our organization is, so that's part of it. So just to walk through it, in the paid leave provisions for employees, there are really what we would call 6 buckets for people to get qualified for it. And the first 2 are if you are caring for someone with coronavirus or you have it yourself, the employee can get 100% pay for 2 weeks from the time they get it, 80 hours or their equivalent. I would also say this paid leave is also for people who have less than 500 employees. And then in buckets 3 through 6 are if you are living with someone who is elderly and at risk, if you're having to care for somebody. The most common FFCRA that employers are dealing with, and the one that's difficult for employers, is the number 5 bucket, which is childcare. And in the case of childcare, employees in groups 3, 4, 5, and 6, which are related to supporting others who are impacted by coronavirus or their childcare has been shut down, the employee can get 2/3 pay for 2 weeks if they're supporting others, an elderly family member or other things, and 1/3, they get 2/3 of their pay. If you are in group number 5, which is the one you most hear often, childcare, employees for the first 2 weeks get 2/3, and then they can apply for under the federal family medical leave provisions for 10 additional weeks and get 2/3 of their pay. So the child care is the one that carries out for 12 weeks. This act started on April the 1st. Many people know that things were shut down in the state starting March 16th, 17th, that type of thing. The benefits of this act started April the 1st. So Ellen, if you want to go to the next page, and I'll cover the CARES Act in a second, but the FFCRA, we've had a number of employees. This is a challenge for employers, but it's also an opportunity that employers have tried to use to support family members who have had child care provisions. The closure of school and child care has created certainly significant challenges for organizations trying to staff their residential programs, and especially if you don't have the pool of day program staff who might be able to move over there. The second is the CARES Act, which allocated $350 billion to help small businesses. And as many people know, the Congress added additional funds this week. They have the most common one you hear about is the Paycheck Protection Program, referred to often as the PPP. They are 100% federally guaranteed loans to small businesses. This is for people that are under 500 employees. It is a loan, but there are forgiveness provisions, and the loan covers payroll costs, mortgage interest, rent, and utility costs over an 8-week period after the loan is made. And we are expected to return our maintain our current employee and compensation levels, or to return them to our employee compensation levels. The PPP that you apply through a small business association, SBA lender, and that could be small banks or large banks. This, as you heard very often, for people that did it, as a provider, we experienced this. And for people, some providers got this and some providers did not, but you had to be ready to go when this was announced now 3 weeks ago. It was announced on a Wednesday. On Thursday, the forms came up, and I'll give you an example. As an individual provider, we had all of our documentation submitted to our local bank by Friday at 3:00, and we were enrolled by Friday at 3:00. And we got our approval the following Tuesday. And many banks were announcing by Tuesday, Wednesday, that the program was pretty much filled out. A number of the larger banks had stopped taking applications within 24 hours after putting it up there. 75% of the money you receive must go towards payroll costs. Payroll costs include employee salaries, it includes benefits, it includes unemployment costs if you're self-insured, which a lot of us are. A lot of private not-for-profits, a lot of private organizations are self-insured in the state, meaning if employees go on unemployment, we pay that directly. We are not in the pool that many large businesses are. It can only be for people whose payroll costs are up to $99,999. Any employees that are over $100,000 do not qualify. And we can only use 25% for non-payroll costs, mortgages, rent, all those type of things. As a loan, you do not have to make a loan payment for 6 months. And within that end of that 6 months, if you meet the forgiveness standards, and the forgiveness standards basically mean that if you return your payroll to its level as of February the 15th, you can be eligible to have that loan forgiven. From a business standpoint, though, even if you don't meet the loan forgiveness standards, it's a 2-year loan with a 1% interest rate. So for businesses that qualify, for profit, not for profit, it is the most inexpensive access to money during this challenging time. Many of us needed this. This was a lifeline for a lot of small organizations and a lot of small businesses, because the state is still having to work with its federal partners on how they're going to continue to be able to pay us money to keep alive day programs and family support programs and other such. And they're working to do that, but that system does not change on a dime. And it's taken most of the month to have that happen. And people needed this PPP to ensure their cash flow. From our organization's standpoint, I can tell you that when this was first announced and we announced we were shutting down day programs and other things and going to remote and residential supports that we do, until they started announcing ways that the local state governments were going to provide us additional resources, and then the PPP was out and people could get it, you know, we were all looking at having 2 or 3 payrolls worth of cash. So organizations run very tight in this state. They run very tight in this country. And 30%, there have been surveys out there that as many as 30% of nonprofits have less than 30 days cash. So we're all very dependent on these kind of federal supports. I will say one of the biggest challenges in our state right now and federally is that nonprofit providers of greater than 500 employees do not qualify for this. And so they can only qualify for straight loans that are being put out right now. So that's a challenge for those. So I'll stop there. But just brief overview.
Thank you so much, Dan. So I'm going to stop and just allow everyone to ask questions. You can either unmute yourself and ask the question, or you can chat it in the chat box.
And this is Nicole. I just wanted to, on Dan's last note, I just wanted to highlight the fact that the over 500 issue is something that we're working on. When I'm highlighting our asks, those are just our broad asks that we're really trying to engage grassroots around. We also have a lot of other things that we're looking for, and one of the ones that we are looking for in package 4 is a fix to include organizations over 500. I know it impacts, I think, about 52 of the ARC chapters nationally. And so it's something that I just wanted to make sure that folks knew we were working on that.
Thank you, Nicole.
Great, thank you. I see there's a comment, Glenn Gabbard, that there's an upcoming webinar sponsored by the Center on Budget and Policy Priorities. More action needed in soon, priorities for future COVID-19 federal legislation. So thank you. We have another question. When would we be moving to the recovery phase?
That's a very complicated question. I do believe that the intention of Leader McConnell is that, first of all, he doesn't really indicate that he wants to do a package 4, but I think the pressure is on enough where that's not going to be an issue. But I think that that's the plan, is that would be the last recovery bill, and we're anticipating hopefully that this bill will be passed by Memorial Day, and then we would be turning to recovery. But timing wise, that might not be until June. And also a lot of this is obviously speculation based on quickly changing quicksand because of the actual public health emergency that we're in. But that's the best I can answer that question.
Okay. Dan, can I ask you, I mean, if anyone else, does anyone else have any questions they want to unmute themselves? You can go ahead. If not, I'd just like to ask Dan, since we have, oh wait, we have one more, sorry, and then I'll ask my question. I've heard that the anticipated scope of the fourth package will be significantly higher than the first three. Is this the case? Well, would you like to answer that?
That's what we're hoping for, that it will be much larger. But I honestly, at this point, it's conjecture since we haven't even seen an outline of, or from either side, either party, or either the House or Senate about what they're hoping to get. But it's going to need to be in order to get the pieces that we're talking about. I mean, the HCBS grant program that I talked about is about $50 billion, which in the scheme of things doesn't sound like much, but it's a big ask. And so we're going to need to see a bigger package, but there's no estimates at this point.
Okay, thank you. For Dan, can you just talk a bit about, and this could be from state resources as well, like that, are most chapters, are they able to keep their staff on? I mean, how has this been playing out for you?
I think chapters are different. The chapters that are just doing day program services have struggled, and at the smaller chapters, some of the guidance that's coming out from the state now, we are going to give people ways to get their day programs, keep their day programs going. But a number of people have furloughed people. I mean, people have furloughed 20 and 30% or more if they don't have jobs for them. Furloughing people allows us to hopefully keep them on benefits. They get unemployment. We can return them to work. But we don't have work for them. That's the challenge. Having 40 hours of work for the large numbers of people is a challenge. I will say that there has been some additional guidance today and yesterday coming out for people who have family members at home. There is going to be some guidance on how day programs will be reaching out to people in order to be able to get their billing. So please be patient. I know some of you may have been getting calls every day, and some like it and some don't, but it's going to be important that in order for day programs to stay vital, to stay alive, that the state has now put in place a thing where we can make a telehealth contact either visually or on the phone with our member in a day have, and hopefully the employment programs for one contact per member per week. And that will allow day programs to be able to bill for their services during that time and stay alive. And that's really going to be essential. Otherwise, we've also gotten money for the residential programs from the safety net to try to support people, but we are spending way more than that. You know, Nicole talked about PPE and those kind of things. We're all spending way more than that than what we've been given to serve our folks residentially, to acquire those materials. So we're still working towards that. But the folks that have residential have been I'm able to offer opportunity for everybody who works in my day programs, who want to work in our residences, to offer it. But not everybody either is able to or wants to. As you can imagine, calling people essential healthcare professionals and inspiring them to work versus people's, just like all of us in life's fears and concerns, is always the threshold that we're trying to help people over.
Thank you for explaining that. I'm going to go ahead and just run through a few more slides, and then I know we're kind of running over on time. I apologize. There was so much information to share. So thank you so much, Nicole and Dan. I just wanted to remind people about the We Are Essential campaign that the ARC of US is leading. You know, we're in our third week of action, access to medication, supplies, and PPE. We're doing another round of home and community-based services where we want to share our stories related to promoting more funds for HCBS. As I mentioned last week, we won a great fight with all the incredible action people are doing and taking and contacting the members of Congress with the SSI, making it automatic for people. So we, really appreciate all the incredible work everyone is doing, and keep up, your action. It's been amazing, both on the federal and state level. And I just want to remind people of our action alerts on our website. Most recently, advocating for reasonable accommodation for visitor policies, for addressing the need for the presence of family members, guardians, or caregivers to assist those with IDD and autism to enter triage, the emergency department, RCU. This was based on the recent revisions of our crisis standards of care in Massachusetts, but we need more specific language around this issue for reasonable accommodations for visitors. So please take a moment to write your senator and representative to advocate for this important issue. And then we still have our advocacy around the hazard pay equity for all human services. There was recently an increase announced, but we want to make sure that it's across all human services and not just for state health and community service workers. This is really important, and we've done incredible work around this issue, and we just want to keep up the momentum and contact your state legislators. Also reach out to Governor Baker and our Senate and House leadership. And then just a reminder about the census. I continue to talk about a lot, but it's so important to the disability community. I saw this meme the other day just describing that the federal government relies on the census data to determine the allocation of PPE and other life-saving supplies to states. So it's just a really, really important issue. Remember to get your census in, and Massachusetts is doing well. We're above the national response rate, self-response rate. So we want to keep that up and just keep sharing on social media about the census is safe, easy, and important. So I think that's it, unless there are additional, I'm going to stop for additional questions. Here's the contact information for Nicole, Dan, and I. But thank you so much for everyone for joining, and thank you so much to Nicole and Dan. But I'll leave it open if there are additional questions or comments.
I just want to say thank you all, and thank you for all the work that you're doing in Massachusetts, and just all the work on behalf of, as a family member, also everything that you're doing to keep people with disabilities safe and healthy during this truly difficult time. Thank you so much.
And likewise, and just ask everybody who's family members to remember that, keep our direct care staff in mind, support our individuals, of course, and our direct care staff who are frontline, like healthcare providers and nursing homes, otherwise caring for people every day. They are absolutely our true heroes. We will never be able to pay them back enough for what an unbelievable job they are all doing every day. So thank you. And for the families that are doing, thank you.
That's great. Thank you so much, Dan. On that note, let's see. I think there was one more chat. I don't know if that's just a thank you. Excellent. Yes, excellent work. Thank you. Thank you, everyone. All right. Well, thank you, Dan and Nicole, again. Thanks so much.
Thank you.
Thank you.
All right. Thank you, guys.
Wonderful job.
Have a great Friday.
Same to you.
Bye.